Hello, and welcome to another episode of At Work Advocacy Update. We have a special guest joining us today from the Washington State Developmental Disabilities Council, Jeremey Norden, who is the council's executive director. Today, we're going to be talking about changes to the Washington COVID vaccination plan.
We are very thankful to the advocacy effort that the Department of Health has actually allowed just people with disabilities to be prioritized for the vaccine.
Starting today, March 17th, individuals with IDD are now eligible as a part of Phase 1B Tier 2, but there's also some good news around caregivers.
Yeah, and I'm very happy to be here and share that news and help people understand. The first thing I want to do, actually, John and Ivanova, is say thank you to you both and to the entire advocacy community, because these announcements that we heard would not have been possible and would not have happened if we hadn't have had all of the amazing advocacy efforts from individuals and groups all across the state, including you two. So I just want to say thank you. It's because of your advocacy that we get to have this conversation today. So yeah, like you said, John, starting today, March 17th, all people with intellectual and developmental disabilities are eligible to receive the COVID vaccine, as you mentioned, as part of 1B2. And the other important announcement is that the Department of Health clarified that all caregivers of people with disabilities, so that includes caregivers of adults, caregivers of children, it includes unpaid caregivers, paid caregivers, formal, informal, it doesn't matter. All those caregivers are already eligible to get the COVID vaccine under the 1A priority group. And so those are the two big announcements, and it's great news for people who have been waiting to get the vaccine and have been very worried, because we know, if you look at the data and the research, that people with intellectual and developmental disabilities have a higher risk of getting the virus. They have a higher risk of getting really sick from the virus. And unfortunately, they have a higher risk of dying from the virus. So it's been incredibly important for us to advocate on this. And caregivers have been very concerned because, you know, number one, they don't want to get sick themselves and get really sick or die, but they also don't want to pass on the virus to someone that they're providing care for. So it's really big news. And I'm happy to address any questions that you two might have about it.
So Jeremey, what's the best way for individuals to go about scheduling their COVID shot?
Yeah, so I know a lot of folks are using the Face Finder tool to just sort of find out if you're eligible. And if that's helpful for you, then you can definitely do that. But I also know that the Face Finder tool can be confusing. There's a lot of questions, and sometimes you don't feel sure how you fit into different questions. And so if you know that you're eligible, if you're a person with an intellectual developmental disability, or you're a caregiver of a person with a disability, and you know you're eligible, what you can do is go directly to a website to schedule your vaccine. I've heard that the most helpful website is www.covidwa.com. It's a volunteer-driven effort. Basically, you type in your zip code, and then it'll show you all of the different places around you that have available vaccines. And then you click the button to schedule it. And once you go there, you can just explain that either you're a person with an intellectual developmental disability or you're a caregiver. And hopefully at this point, all of the vaccine sites will understand that, and they'll have gotten the update, and they won't give anyone any challenges. But I think folks should be prepared to advocate for themselves or a family member if they need to. And just, you know, it might be helpful to print out the guidance, or just be prepared to explain to some volunteers or some vaccine providers who may not quite understand the changes yet. So we're continuing to advocate with the Department of Health to make sure that all of the vaccine sites understand the changes and aren't giving anyone any barriers to signing up. So I think that's probably the best bet right now, John.
Great. Thank you, Jeremey. This is great news for individuals with IDD that we support.
Well, that's all we have for now. Thank you, Jeremey, Norden, for your wonderful presentation and information around this exciting news. And I hope everyone finds this information helpful. Thank you.
Thanks. I appreciate you both very much.
For the most up-to-date information on COVID-19 and vaccines as it relates to people with disabilities, please visit www.informingfamilies.org/vaccine.